Well, good afternoon, everyone. My name is Randy Konauer, and I'm with Holy Family Memorial. We've got offices in a hospital here in Manitowoc and then another one down in Sheboygan. This webinar is sponsored by Manitowoc Cranes, which is a division of the Manitowoc Company. And this is session 4 of the Safety, Health, and Wellness Committee and of Manitowoc County Chamber. And this series is part of what we're calling the best practices during COVID-19. This webinar will be up on the Chamber's website later on this afternoon or tomorrow morning. Our next webinar will be Tuesday, October 20th. That'll be led by Holy Family Memorial's Tom Beezer. And Tom is the Chief Nursing Officer at Holy Family. And at that webinar, Tom will discuss the impact of senior isolation and behavioral health, and also the impact of delaying health services due to COVID-19. Today's webinar will be led by Dr. Ashok Rai. Dr. Rai is the President and CEO of Prevea Health. He's also a practicing internal medicine physician. He holds degrees from the University of Wisconsin-Milwaukee and the Medical College of Wisconsin, and has completed residency in internal medicine and pediatrics at the Kalamazoo Center for Medical Studies. Without further ado, Dr. Rai.
Hi, everyone, and thanks for having me. I know some of you had submitted questions ahead of time, so I'm going to try to get to those the best I can. But most of these sessions, I like to just, make sure that you get your questions answered today. So please make sure you're submitting them. I think there's a methodology on both Facebook and under Zoom for you to do that. And I'll pay attention to the chat bar for that. And speaking of questions, the first question I always get is, how is Wisconsin doing? And then that question, I have an unfortunate answer to. We're doing pretty awful right now. Our percent positivity in the state continues to be at a number that is unacceptable. It's creating more and more spread of the disease. And I know many people would say, well, not everybody gets that sick. You're right. Actually, some people don't get sick at all. They become asymptomatic, but it gets enough people sick. It gets enough people sick that have underlying diseases to cause them to need to go to the hospital. And that's what we've always tried to educate and prevent. And I think a lot has gotten lost, over the summer, probably due to COVID fatigue, media fatigue. I'm tired, we're all tired, that the discussion became around the virus not being that bad. And instead of what the virus's impact to infrastructure is. And that's what happens in a pandemic. The virus's impact on infrastructure is what we worry about the most. Because understand the American healthcare system, your healthcare system in Manitowoc County, which we are a part of, Sheboygan County, Brown County, Northeast Wisconsin, was really built and designed to take care of the needs of today. The car accident today, the heart attack today, the stroke today, the baby being born today, the hip surgery today, with a little bit of capacity for busy seasons, such as an influenza season or say a bad respiratory pneumonia season. That's the capacity it's designed for. And that's the physical space, the nurses, the doctors hired, the janitorial staff, the food service, that's what they're designed for. Now layer on a pandemic. So that is what is causing all of the strain. That's what's causing all of the concern and why we're asking for help in healthcare. Because I'll take Brown County as an example today, and Randy and I were just talking about Holy Family numbers as well. But Brown County today has as of last night, 126 COVID patients in the hospitals. That's 4 hospitals. You would say 126 is not a big number. New York was reporting thousands. Remember, we're a little smaller than New York, so take that into consideration. But more importantly, that's 126 beds that are requiring a lot of staff, a lot of personal protective equipment, gowns, masks, everything. And that's causing us not to be able to take care of everything else. So right now, I'm sitting at St. Mary's Hospital talking today. There, to my knowledge, is 1 bed open. That's for the next heart attack. That's for the next COVID patient. That's for the next bad pneumonia that needs a ventilator. You can do your math real quick on how many we admit in a day. Say we have 10 to 15 admissions a day. What are we going to do with the other 14? It's putting them in the ER, waiting for open beds, trying to figure out other ways to take care of it. The system is at capacity. So it's not the COVID patients alone that we should be having this discussion about. It's the overall ability to provide healthcare to everybody that's at risk right now, not the ability to take care of a COVID patient, not the ability to have enough ventilators to take care of them. Those are all very serious concerns. And I don't want to in any way understate how serious this virus is and how sick somebody gets and how fatal it can be. It meets all of those criteria. But I think a lot of the public discussion, unfortunately, has been around it's not that bad because of how many people don't die, or it's not that bad for how many people don't go to the hospital. You're right. Good chances if you get it, you aren't going to die. There's a good chance you won't even come to the hospital. But once again, enough people are dying and enough people are coming to the hospital. And that's what's creating that infrastructure strain to the point of near collapse right now. So that's what's going on in Wisconsin today. Pardon me, don't you have to clear your throat and say not COVID? I did get tested this week because I have to because of my nursing home job, seeing patients, but I've been talking all day, unfortunately. So I needed to clear my throat there, so I apologize. I wanted to kind of dive into some of the most common questions as a Chamber of Commerce, as employers that you come to us in healthcare with. This is my cell phone right here, and it pretty much goes off nonstop. And a lot of it are the same questions. So I kind of wanted to cover that and then take more questions from all of you. And I did have a chance to review some of the questions that were submitted. So I put together a little presentation that covers 3 or 4 of those kind of all put together. So I'm going to share my screen for a second. And we're going to talk about the differences because these terms, and I blame the media for this because they're not here, so I can blame them, is people use 2 terms interchangeably and they're not. The terms isolation and quarantine get tossed out there a lot. You use them even in your employee handbooks. Not all of you have it correct as well. I get a call all the time about that. So we're going to go through the definition of isolation and quarantine, and then a couple scenarios under quarantine that really are specific to employers on getting people back to work or how long somebody needs to be out. And once again, cut me off with a question or anything you might need. So what is isolation? Isolation is the term we use when somebody tests positive for COVID-19. So whether you are a physician, a nurse, somebody who works at a grocery store or restaurant, or the President of the United States, when you turn positive, you are isolating, not quarantining. And if you are positive, you need to isolate for 10 days from the onset of your symptoms, or 10 days from the day of your test if you never had symptoms. And the last 24 hours of that 10 days, you need to be free of major symptoms such as respiratory symptoms and a fever. If you still have those on day 10, you keep going until you have 24 hours without that. I'd say 99% of the people are done in 10 days though. And when you're in isolation, you stay home except to get medical care. You monitor your symptoms, and if you're having trouble breathing or getting worse, dizzy, those are reasons to seek emergency medical care. It's 911 or the emergency department. You actually have to isolate away from your family members. If you're married, this means sleeping in different rooms, using different bathrooms. I guess it'd be my wife's dream come true if I got isolated to the basement. But you have to separate. Use a separate bathroom, like I said, if possible. Avoid contact with other members of the household. And if you do have to go out into public of your house, in other words, into an area like the living room or the kitchen briefly, make sure you're masked. And don't share household items like cups, towels, and utensils. That's isolation. 10 days on the bench, as I like to say, is isolation. Sorry, I'm going to advance my slide to the next one here. So what's quarantine? This is what everybody likes to use the word. I think it's because it's a common word that's used for other aspects of life. So a quarantine means you have no symptoms and that you had close contact with somebody who has COVID-19. You shouldn't go to work. You should be wearing a mask. Kind of the same things with isolation, but quarantine lasts for 14 days after your last close contact with a COVID-19 patient. And we recommend testing for that patient that's in quarantine around day 5 or 6 because the likelihood of you being positive is highest on that day. The most important thing you have to remember about quarantine, you could be tested every day for the 14 days, no matter what the result of that test is. Sorry, if that test is negative, you are still in quarantine. The only thing that will change the timeline is if you turn positive, because now we go 10 days out from that point. because now you're suddenly in isolation. So 14 days, we recommend one test at day 5 to see if you're positive. Why do we want to know that? To see if you've exposed other people, because now you're the positive person and we have to draw a new circle around you. We drew a circle around the person you came in contact with. That's why we quarantined you. Close contact. Get this question a lot. What is a close contact? Close contact is not walking by somebody in a grocery store and finding out, 4 days later that they had COVID-19. Close contact is being within 6 feet of somebody for a cumulative time of 15 minutes in a day. That could be 3 5-minute encounters. It could be a 15-minute meeting. Don't care if you're masked or unmasked. CDC says 6 feet, less than 6 feet, 15 minutes, you're in quarantine. Direct physical contact is an automatic. You touched, hugged, kissed, shook hands with somebody, you are immediately a close contact. So the 6 feet, 15 minutes don't matter at all if you outstretched your hand and you shook somebody else's hand and you found out they have COVID-19. If you shared eating or drinking utensils with somebody, you provided care to somebody with COVID-19 who is homesick, or somebody sneezed or coughed or somehow got respiratory droplets on you. All of that, those 5 things, and those are the only 5 things that can put you in quarantine. And it's important to remember that. So what's the timeline we draw? The timeline is if somebody's is turned positive, they're in isolation, we go back 2 days. So say it's a Friday, we will go back Thursday, Wednesday, and everybody 2 days prior to that day that they've turned positive, that they've had contact with before they begin isolation, and they meet any of these 5 criteria are now in quarantine. So walk through a couple scenarios. I saw a question pop up. I want to make sure. And I will. So quick question. Some people talked about the pet issue. I think the recommendation is to stay away from your pets. I don't know of any science behind that recommendation. I've looked for it. Dogs specifically, we know that they can carry it, but they can't transmit it to a human. But I think it's out of good science caution that that's been recommended, that you isolate away from your pets. If you're married to a healthcare worker that works with COVID-19 patients and are using appropriate PPE, should we live in separate areas of the house? It's a personal decision. The CDC would say, no, you don't have to, but I would want to make sure that everybody is monitoring for symptoms every day, multiple times a day, and getting tested as often as anybody could be symptomatic or there's a known exposure. Given the rate of spread we're seeing in Brown County right now, in Manitowoc County, Sheboygan County, I have a really high concern for it, a low threshold for any symptom to get tested, just given the type of spread we're seeing. You're welcome, Kathy. All right, so scenario 1. And I'm trying to get the chat box to go away so I can see my own slides. I apologize for that. So scenario 1 is close contact with someone who has COVID-19, one of those 5 categories, and you don't plan on having any further close contact with them. That is somebody you had a meeting with, you work with, you're in a classroom with, and you've had a close contact with a friend who's had COVID-19. So your quarantine starts the date of the last contact, and you are quarantined for 14 days. Remember, can't test your way out of it, but we want you to be tested on day 5. This is the easiest scenario to walk through. Scenario 2, close contact with somebody you live with, but that person can isolate. You have a 14 or a 15-year-old child that turned positive due to a school contact. The child can isolate to their bedroom. You can deliver food out in front of their door, knock on the door, walk away. It's a teenager's dream come true is isolation. And for some teenagers, not for all. You can isolate away from them. Then it's 14 days from that last contact you've had with them. So pretty similar to scenario 1, but scenario 2 is in the same household, but still the ability to do that. If you test positive, can your child go to school? No, because they're in that same household. They're on a 14-day quarantine. Scenario 3, this is where things get a little tricky, because every time while you're in quarantine that you come in contact to another person that turns positive, your 14 days starts again. So you have a household contact who has COVID-19, say 1 child, and you started your quarantine from your last contact. And then several days later, another child becomes symptomatic and tests positive. your 14 days start again. So you can see that in the calendar here. 14 days will start on Wednesday. Oops, another kid's positive. 14 days starts on Monday, and now it's the 19th. So you can look at 19 days of quarantine versus the 14 because of that. This gets really complicated with children in school, so that's why I'm giving you those scenarios like that. Scenario 4. This is probably the most frustrating for employers to understand, for people to understand, and for us to guide people through. This is when you can't isolate away from a household person that's turned positive. So my child tests positive for COVID-19, and I need to provide direct care to my child who is sick. I'm a single parent, and no other parent can provide that care, and the child can't be on their own. They're 4 years old. So your 14 days start when their 10 days is up. So you're looking at 24 hours or more, depending if they're fever-free on that 10th day, 24 days of quarantine. And there's no public health way out of this. There's no testing your way out of scenario 4. But it has happened, and it happens a lot, more than you would think. Scenario 5, probably the second most common one I get, the I don't need to quarantine one. So that's contact with somebody who had contact with someone else who had tested positive for COVID-19. This is that second degree connection. This is the Kevin Bacon question as I get. I found out my child's teacher has a household contact with COVID-19. Does my student need to be tested or quarantined? No, actually only the teacher does. Now, everybody should be monitoring for symptoms. If that teacher in their quarantine period turned positive, then yes, the student would need to quarantine and go through that if there was the direct exposure. But it really comes under the only people who quarantine are the people who fell into those 5 categories with the person who's positive. So you can't stretch it to the next person to the next person. So it's really, you have to have had that contact with the positive person to be quarantined. So I hope that helps. It's probably the most common set of questions we get, isolation and quarantine questions. It affects, I think employers the most, HR departments the most. And we, deal with it even in healthcare every day. I'm going to get to some questions now, if that's okay. So in the chat, if someone has COVID and recovered, will they need to quarantine if exposed to someone who tests positive? Great question, Jessica. No, for 90 days. So once you're done with your 10 days of isolation, you have 90 days of not having to worry about contact or quarantining again. If you get severely symptomatic in that 90 days, we will likely work you up because we want to make sure there's not a reinfection, but actually we have no evidence of reinfection in 90 days in the United States. So the CDC has said 90 days, you're good. So once your 10 days is up and you're symptom free, you're good for 90 days, even if you contact somebody who has COVID-19, i.e. a healthcare provider. You're now the person on the front line, unfortunately. What if you're wearing a mask when you come into contact with a COVID-19 positive? Teacher has a mask on. So the CDC would say mask or not, you still need to quarantine. We still need to be safe. Remember, the mask is there to prevent you from trying to spread COVID-19. The masks you generally would wear, unlike an N95, and I don't have mine on my desk right now at the hospital here. It's in my doctor bag, my little black bag, believe it or not, I have one. That, unless you're wearing a level of PPE that we would normally wear, it does not protect you. It's protecting other people from you. So yes, you would need to quarantine. If someone tests positive for COVID-19, how long are they contagious for? 10 days. So Jill, it goes back to Jessica's question. It's 10 and done. So as long as your symptoms are done on 10, you're done. So there is no, I need a negative test to come back to work. You might not get a negative test for 8 weeks because the virus will continue to have genetic material in your nose, in your mouth for weeks after you've recovered. So it's 10 days to recovery and no need to get a test to get back to work. I think that was a question that was out there. And actually that will limit you ever getting employees back, because trust me, some people have been testing positive for, like I said, 6 to 8 weeks. And when we actually culture that virus, in other words, try to grow that virus, it's not a replicating virus. It is not an infectious virus. It's just the remnant genetic material is the easiest way I can try to explain that. There's 4 questions in the Q&A. Are those getting copied to the chat? I just want to make sure. Being that testing and results is taking upwards of a week from symptoms starting, how is that affecting the rate of spread, as well as isolation quarantine requirements? Is there any chance of being some relief in testing? So Melissa, it's my It's my daily job on this question. I have met with the White House, FEMA, and the governor's office throughout the weekend to increase testing capacity in all of the counties that Prevea clinics are in. So that includes Manitowoc County. On Saturday, we found out that the state was switching the lab that we get our testing supplies through to get us a larger pipeline. Those supplies actually arrived today in 2 massive FedEx trucks. They'll be implemented on Friday. So we hope to increase the total number of testing being offered in all of our areas. Our turnaround time is from time of test is 72 hours. So that's our goal. Occasionally gets a little longer if there is a transportation issue, because remember, it has to go someplace. And we are working actively with FEMA to get antigen testing rolled out. Now, antigen testing is not the kind of testing that you are going to get back to work, or a negative test, those types of situations. They're really good if somebody's symptomatic to know if they have COVID or not. If the test is negative, we still have to go through the normal PCR test that we've been talking to you about. We started antigen testing with healthcare workers yesterday for the first time, and it's working well. And we've been doing that with UW-GB and UW-Oshkosh now for a month, and we'll be rolling more of that out to the market as quickly as possible. We have no tools other than testing in healthcare. So the community's tool is wearing a mask and stopping the public gatherings when you have an outbreak like we do. When I say wear a mask, I'm talking about when you're in an enclosed setting. I'm not talking about when you're taking a walk. Don't get in a public gathering unmasked. And a public gathering is, significant size, number of people. And if you're inside, definitely be wearing a mask. But testing is healthcare's tool. Yes, we have remdesivir. Yes, we have convalescent plasma. And yes, we have dexamethasone. You don't want to hear those 3 words. That means you are not doing well in the hospital. It means you're requiring oxygen if we are using those terms with you. So for the general public, the tool that healthcare has is, number 1, educating, like we're doing today, and testing. And so it's been my number 1 frustration since March, and we continue to ramp up our supplies. We continue to test more people, and it's really county specific on what we can get, but we are actually going to be working through the weekend to increase testing capacity in every county that there's a Prevea clinic in. Hopefully that answered your question. I share your frustration. Manitowoc Health Department is not contact tracing, not even in schools. How concerned should we be about our community's ability to control outbreaks? How will it even be identified? So it's a big concern of ours. So we've been working with local public health throughout all the counties, understanding that they're stressed, they're getting sick, and what can we do better in healthcare? So starting this week and actually being revised by public health, and I think the revision is done, every time somebody tests positive at Prevea, they get an automated message into their My Prevea account, basically starting all that isolation and quarantine instructions we just did and starting contact tracing on its own. That is far from ideal. We are working with the state to get more contact tracing in place. Secretary Plum is committed more funding towards that. But till we get it, we need you all to understand isolation and quarantine and to educate, because almost everybody is turning positive in a school system or has a job. So the easiest thing we can do right now is to educate all of you, so you can educate your community, your employees, and make sure we're doing it right. And if that slide deck I have would help you in any way, we will share it. That way you can refer to it. And you can also we have the same stuff on our website to refer to. Is the employer required to do the tracing? Chuck, they're not, but I recommend you do, because if public health is way behind, you don't want that outbreak. I mean, we want businesses to thrive. I mean, think about it. Healthcare doesn't do well if people don't have jobs. The economic model of everything collapses. So we want everybody to do well. There's certain parts of the economic sector right now that are hurting more than others. I feel bad about that. I'm so glad that more assistance is coming from the state to those sectors. When we say no public gatherings, it hurts us. We don't want to hurt anybody on purpose. But for an employer to do their contact tracing, use that PowerPoint I just have, use our handout, do your own, because if you can control the breakout in your business, you keep your business making money. It is in your best interest to do it, and we're here to help you do that. Kathy has a question. I'm in the travel industry, and as clients are starting to travel, yeah, the 72-hour question, we are rolling that out to help people through that. A weekend departure date impact the timing on their results. No, and we're trying to get it really down to a better science for these patients, Kathy. We understand travel is necessary for the economy as well. So we're rolling out things to make it easier through our travel department. But you should be able to get results by Monday within a pretty much set 48 to 72 hours. Looks like the staff would be good to use with staff and others. The slides would be. So I will send it to the Manitowoc Chamber. Awesome people who asked me to do this, and we'll get them to you. Please somebody chat. There's a Q&A section and a chat section, so I want to make sure I'm hitting all the questions and answers well. I'm going to take a minute to try to load up the questions you all gave to me as well. So give me a second. You can see my head pivot all over the place here as I try to find that to make sure I've covered them. So the questions you also had, do I agree with the recommendation to wait 5 days after contact to get tested due to the potential of a false negative? Yeah, I'm the one who just recommended it to you. Yeah, actually, DHS is saying 5 to 6 days, so don't call 5 a hard stop. 5 to 6 days is kind of that sweet spot. And it's not really a false negative. It's giving you enough time to show that the virus is replicated enough that you actually are being infected or not. And it takes that long to figure that out. So I hate the term false negative in that respect. It's really to make sure you're infected or not. Does an employer need to inform their employees if there was a positive employee, quarantine, or infected person in a workplace? I'm not a lawyer and I'm not a politician. Do you have to? Probably not. Should you? Most definitely yes. Why is Wisconsin doing so poorly in comparison to other states? We are actually not doing poorly in compared to other states. We are doing poorly in comparison to the entire world. We are the worst per capita, or I think one of the worst right now, if not the worst in the world. Why? Really, we didn't use science to open up the state like we should have. We just kind of opened the doors. So we never had a chance when we started to see rising numbers to pull back on any part of the sector. And now we're in a situation where we're like, well, what do we do? It's got to be public education. We got fatigued and unfortunately started to let our guard down. We thought of this as a disease that's not going to hurt me. So if some people go in the hospital, it's not that many, so it's not that big of a deal. And all of those factors added up to where we're at today, nearing a collapse. If we're approaching capacity at some local hospitals, Green Bay, Appleton, Wausau, and as my colleagues pointed out, even at Holy Family, why are we not building makeshift hospitals at empty buildings and asking volunteers to come from other parts of the country? Well, right now, physical space isn't the limitation, it's people. We do have people coming from all around the country flying in to help us right now. Understand the makeshift hospitals, it's more than just beds, it's oxygen, which is not exactly something you want just rolling around in a factory without safety precautions. And you need skilled people and physicians that are skilled to take care of it. And there's outbreaks throughout the rest of the country. So getting labor has been really our number one issue right now. So you can only take care of a patient in that setting that's really low acuity, that's probably a day away from going home anyway. So we've looked at it, doesn't make sense. Really, it's people that we need. If in a workplace, everyone is wearing their mask and one of the people gets COVID, is that person that has come in contact was supposed to get tested or quarantined? How would the time and distance rule work in this case? So masks don't affect the time and distance rule. It's still 6 feet, 15 minutes. Many people state they are not wearing masks because they're working on their immune system. How would I address that myth? It's a myth. Show me the science behind that. You are still being exposed to tons of bacteria and viruses every minute that you're not wearing that mask. So the mask there is protecting you from spreading everything you're inhaling to everybody else. And science is pretty solid on this one that it works. Now, am I one of those people that says you have to wear a mask 24/7, wear it around your house? No, I'm practical. Have I forgotten my mask in the car? Yeah, I've done it. Once my wife dropped me off at a car dealership and drove away and I didn't have my mask and I thought it was a contactless delivery and I didn't have one. I had to go in for 5 minutes. I'm not asking everybody to be perfect at all. And if you're outside and you're hanging by a pool and you can physically distance, no, that's not the environment to wear a mask. I think we've taken the debate to the extremes. Let's just be practical. If you're inside, congregate setting, put a mask on. explain the quarantine process. That's where I got your 14 and 10 days and a lot of confusion and changes. So hopefully I clarified that. Number 8 comes a lot. The 8th question on this list comes up a lot, and I actually want to answer it. I tried to answer it the first time, but I think it deserves a direct answer because I heard of a couple employers. I don't think they're in Manitowoc that are doing this, but other places. Is it necessary for the employer to require a negative COVID test prior to returning to work following exposure? So if it was an exposure, no matter how many negative tests you get, that person can't come back for 14 days. There are 2 exceptions to that: healthcare and critical infrastructure such as law enforcement. Not essential employees, but critical infrastructure such as law enforcement and healthcare can escape quarantine only for work purposes, and they have to re-quarantine, and we have to wear a certain amount of PPE, and there's a different testing protocol for us. So if the sheriff's on the call right now, or the police department's on the call, they know they have an exception. Healthcare knows they have an exception. For the rest of everybody, it's 14 days. You don't want that person in your environment, even if they test negative, because remember, they can test positive on day 14 even. So we recommend day 5 in the quarantine for testing, but if that's negative, it does not end quarantine. You cannot test your way out of quarantine. And that's something that I think, I was once joking around in a Brown County Public Health meeting that I want to buy a billboard that says that. It would probably reduce the number of calls I get by a quarter. So it looks like we have a couple more things that popped up here. Hopefully that helped. Is the 15-minute continuous or total through the day? So Chuck, it's a cumulative. It could be 3 5-minutes. It could be 15 1-minute encounters with the same person. It's cumulative in a day. Do you think that the schools should be shutting down? Will that force children into homes of more at-risk individuals? Right now, I can't tell you what to do or not do. I think school boards have to look at the fact that many counties, Outagamie and Brown, have declared public health emergencies. We need to respect that. We need to respect the fact that the governor, through the secretary, said, let's cut down our public gatherings. School is a public gathering. School has an exception in this setting because there's a lot of reasons to go to school. As you heard in the introduction, I'm not only trained in internal medicine, but I did 2 residencies, 1 in pediatrics too. This is very important to me. But there's a time and a place for everything. And the safety level, what's going on in your own community, there's a point where the schools could be doing everything perfectly to mitigate spread, but it's so rampant in the community that they can't mitigate it, and they can only make it worse. So people need to weigh those decisions as they go forward. More and more people are saying it's so high because people are retested and still testing positive. The state of Wisconsin actually filters out repeat testing, just so you know, in 90-day increments. So that's not the case. How do I convince people? I've been trying every day. If the staff have their own office, they need to wear a mask if no one else is. No. So doors closed, I'm sealed, mask is off. The minute I go in that hallway, this goes on. Great question though, Sarah. Run into it a lot. All right. If someone tests positive for COVID-19, how long are they contagious for? We did that. Why are they not giving rapid tests being available for healthcare workers? We just are getting them in right now. And right now we are doing our best to get healthcare workers healthy enough to take care of you if you have a heart attack or a stroke. We want more rapid testing. But remember that rapid testing that's out there is antigen testing. So it's not the type of gold standard that you're used to. So it works great if you have symptoms, and we're rolling that out more and more throughout all of our communities, but you have to be symptomatic for it to be accurate. If it's negative, you still may have COVID, and we have to do a PCR, and that can take 72 hours. So you still have to isolate if you have symptoms. Besides educating our employees on masks and social distancing, should employers be encouraging employees to donate plasma? What are the other things we can do? I think, number one thing is, definitely encourage them to hang out with their direct family and stop the large gatherings. How many of these patients that are above me right now could I track back to a wedding, to a birthday party, to a family gathering that probably should not have happened? As far as donating plasma, for every person that's turned positive after you've been a month after you've gotten your diagnosis, please donate blood. We need your plasma. We definitely do. If someone tests positive, and sorry, I'm getting old, I got to read my screen here. If someone tests positive and you isolate for 10 days and the employer requires a doctor's note to return to work. How would this work if that person doesn't have a primary physician and the testing isn't ordered by a physician, as most people don't go to their doctors for this? So I would hope that employers would understand the rules. That's why we're presenting it to you. So if an employee shows you their test date and it's 10 days away from there, you should not be requiring a doctor's note. All you're doing is stressing the healthcare system to do paperwork that we shouldn't have to do. It's CDC recommendations straight up 10 days. So the doctor's note is all you're doing is adding more burden onto a healthcare system that right now we're just trying to breathe. So I would appreciate, trying to stop that. How do we convey the message to those that say this is all a hoax, testing is inaccurate, deaths are making hospitals money, and masks are for the sheep, doctors who even say this is a hoax? So I don't know. I'll just be honest with you, as friends, as community members, there's always going to be a naysayer. And thanks to social media, there's always going to be somebody that's going to be a keyboard warrior that has no science behind their name. There are people who call themselves doctors who have not gone to medical school, done a residency, and have actually practiced taking care of these patients in critical care units and hospital floors, or in clinics or in nursing homes. So let's make sure we're paying attention to people who are trained in this and can talk about it. You don't have to be an infectious disease physician to know this is a new virus and how to prevent it. This is something we all learned over time. We all know how to read research, and we should be basing our statements based on research. For everybody else, if I could convince them, but Sarah, you asked this question. I've been trying to convince people to stop smoking for a long time, to eat healthier, to do things that are healthy. We're always going to have our naysayers. All we can do is focus on getting the message out there over and over and over again, and hope and pray every day that nothing bad happens to those people that are not paying attention. Did I miss any questions? So whoever the moderator is, if you want to let me know, because I would feel really bad, but they keep popping up. So. And are there any other questions from the moderator? I'm going to look at the chat here real quick too. Whoever FS is, thank you. And looks like that's it. I think I got everybody's questions answered. And actually, to Jill's question, every test actually does have a physician's name on it. For example, about 95% of Prevea's tests are signed by one physician, yours truly, because we all had to take a job, and so I sign them every day. And we actually have to sign the orders electronically. So that's, I think I've signed close to just myself, 80,000 since June. So they are signed. So if somebody's really mandating a letter and it's a Prevea test, they can contact us, and I've had to do some of those declarations. So, I think a lot of in the hoax is about, us making money off of this. Trust me, a surgical bed versus a inpatient COVID bed, you would much rather have that surgical patient. This isn't a money-making thing at all. We have actually had significant financial losses over this time, which obviously everybody at some point will try to recover, but not right now. And I think the rapid testing question, everybody wants it. And why are healthcare workers getting it first? Because number one, we got to take care of you. And we are trying to ramp it up. I mean, I asked FEMA for more. We received today 3 rapid machines. So people coming in the emergency department, we know which way to send them. That's how difficult it is, COVID or not. So we'll be able to know that right away. We want to continue to expand testing to all of you. We really do. I think I can turn it back over to the moderator at this time, if there's nothing else. Thank you, Kathy, for the nice words. All right, so I guess I was just told that they will just end it. So I hope everybody got what they needed out of this. Real quick, before we end, I think everybody can see the chat here that is on from the chamber. If you wanted those isolation versus, actually, you know what, it'd probably be easier if I just send it to the chamber and they'll send it to you. But also on Prevea.com, if you actually Google Prevea and quarantine, there's a handout you can get. And Prevea isolation, there's a page you can get for that. As much as you can help doing your own contact tracing, because public health is so overwhelmed in Manitowoc County, they can't do it anymore. In Brown County, they're 10 days out, wherever your employees may be that you're tuning in. And if there's anything we can do at Prevea to help you with that internally, feel free to reach out to me directly and we'll help you out. Thank you, everyone, and thanks for the time today.